Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the scalene muscles. We have three scalene muscles: anterior scalene, scalene middle, and scalene posterior. So we have three muscles. These muscles are slender. They take origin from the transverse processes of the cervical vertebra and they insert on the superior surface of the first rib or on the second rib. Let's start from scalene anterior muscle. Origin of the muscle from the anterior tubercle of the transverse process of third, fourth, fifth, and sixth cervical vertebra. So this is the anterior tubercle of the third, fourth, fifth, and sixth cervical vertebra, and this insert on the superior surface of the first rib on the scalene tubercle. Okay, we are seeing here also the scalene medius muscle and scalene posterior muscle. Scalene anterior, scalene medius insert on the superior surface of the first rib. Scalene posterior inserts on the superior surface of the second rib. So what is the nerve supply of the scalene anterior muscle? The scalene anterior muscle is innervated by the anterior rami or ventral rami of C4, C5, C6, C7 spinal nerves. Action of scalene anterior, it elevates the first rib. It also flexes the head. And the scalene muscles are also accessory muscle of respiration. Okay. So we go to the scalene anterior, its relationship that is very important to us. Relationship, structure relationship, phrenic nerve passes down over the scalene anterior. So this is the phrenic nerve. This is passing over the scalene anterior muscle. Phrenic nerve, we know that its root value is C3, C4, C5, and the scalene nerve innervates the fibrous pericardium, mediastinal pleura, and also the gallbladder on the right side. But the most important nerve supply is to the diaphragm. Okay, so this is going down over the scalene anterior. The trunk and roots of the brachial plexus and the subclavian artery lie between the scalene anterior and scalene medius. So this is the subclavian artery. This is the scalene anterior. This is the scalene medius. In between them, we are getting the upper part of the brachial plexus, root and trunks, and underneath here, between the scalene medius, scalene anterior, we have the subclavian artery. Okay, we got that. So subclavian artery passes between the scalene anterior, scalene medius. How about subclavian vein? That passes over the scalene anterior muscle. The scalene anterior is also crossed by the transverse cervical artery, a branch of thiocervical trunk. There is a branch of subclavian artery. Okay, we'll go to the next image. We'll also get scalene anterior is also related to the ansa cervicalis. Okay. Now scalene medius muscle. Again, we'll go to the posterior triangle. The floor is partly formed by the scalene anterior, scalene medius, and the scalene posterior muscle. Okay. So if we go here, scalene medius origin, transverse process of 2nd to 7th cervical vertebra, insertion superior surface of the first rib, posterior to the groove for subclavian artery. So in front of the subclavian artery, we have the scalene anterior. In front of the scalene anterior, with the subclavian vein. Behind the scalene anterior, we have the subclavian artery. So insertion, superior surface of the first rib, posterior to the groove for subclavian artery. So subclavian artery is present between the scalene anterior and scalene medius. Nerve supply, ventral rami of C3 to C7. Action, elevates the first rib, flexes the neck laterally. We'll go to the scalene posterior. Okay, this is again scalene anterior, scalene medius. In between them, we have the brachial plexus, and certainly we have subclavian artery. And this is scalene anterior. It is the phrenic nerve passes over it. It is crossed by the transverse cervical artery, branch of thoracocervical trunk, and this is brachial plexus. This is the subclavian artery between the scalene anterior, scalene medius. Over the anterior part, lower part of the scalene anterior, we have the subclavian vein. Okay, we got here is scalene posterior, that is behind this. This is scalene posterior muscle, and the scalene posterior taking origin from the posterior tubercle of the transverse processes of the C4, C5, C6, insertion to the superior surface or upper surface of the secondary. Nerve supply, ventral rami of C5 to C7. Action, elevates the secondary, also help in lateral flexion of the head. And that's all about the scalene muscle. If you have any question, please feel free to ask me. Please share the information with your friends. And please support my channel. Please subscribe me. Have a nice day. Bye now.